Joining us to talk more about this is the virologist at Lancaster University, Muhammad Munir. Great to have you with us, Muhammad, on the programme today. So multiple countries have now suspended the use of this virus. Do you think that they're right to be concerned?
Well, Ruben, the public health safety is the primary importance. And whenever there is any trend, we will see not only on this occasion, but also if you remember into the clinical trials, the advising is to stop and suspend and investigate into the data and see whether this is a genuine connection or not. And if we look onto the data that has been collected so far, there have been 17 million doses already been given across the continent in the UK and in the EU. And out of that, there are only 40 cases, which is only 0.002%, 1.5 million cases. So that is significantly less compared to what you would see normally into the population. So as it stands, there is any strong link.
So you don't think there's a medical cause for concern then? Do you think this is potentially a politically motivated decision?
Well, at the moment, the data doesn't really suggest that there is any link between the thrombosis, whether it is a deep vein thrombosis or into the lung, which is called pulmonary thrombosis. But what I can see is that if there is any concern, as it has been seen not only in the EU, but also, I mean, we have seen these cases in the UK, but those are the regular occurrence that is being seen, even if the people are not vaccinated with this one. So therefore, I think scientifically it is not backed up, but again, tomorrow EMA and also the WHO will be making statement to really make sure that there is any scientific backing for this link.
Do you think though that the countries that have suspended the use of this vaccine are potentially running the risk that actually not vaccinating might be worse than the effect of a blood clot?
Yes, absolutely, Robin. It's a very important point because we are at a very sensitive stage within this pandemic, that we are having a third wave coming up into Europe. We are having a very low supply of the vaccines, and any kind of ban or any kind of hesitancy that is introduced is going to go into the disadvantage. And even if there is a very loose link between the blood clot and in the vaccine administration, we do know based on our data that the COVID-19 infection itself reduces the thrombosis, the blood clot formation. So therefore, if we consider all of those factors into account, still the vaccination outweigh the risk caused by the thrombosis.
It must be quite confusing, though, for people who are in line to take the vaccine. They have their appointment, but when medical professionals can't agree whether it's okay to take it or not, it must be very difficult for them to go ahead and make that decision to take the vaccine.
Yes, absolutely. I mean, not even in the general public, but also in a scientific community, whenever these things come, it does pose a risk. And just to put into the perspective, today morning, I got my AstraZeneca vaccine. And when I heard first about this one, the first thing I did, I looked into the data, made sure that I can interpret it correctly. And I made the decision to went on. And now I have the AstraZeneca vaccine in my left arm. And just to make sure, and I would like to ensure all the public, is that the data has been rigorously tested and this vaccine has been rigorously tried and trialed. Therefore, rest assured it is safe to be taken if you are offered so.
Okay, good advice. Muhammad Munir from Lancaster University, many thanks for joining us.